This will be a quick demonstration of how to use our low-income subsidy grids to be able to determine an individual's premium as well as their cost share amounts for prescriptions if they have low-income subsidy. Simply go to devoted.com, click on the Members section, and you can go down to either the Documents and Forms or Prescription Drugs section. Either way, you want to get to the benefit and coverage details. Here you can simply put in a zip code, and then you can choose the plan that you're wanting to view. I'll go ahead and choose the Prime plan in this instance. Then click See Plan Documents. Once you're in the Plan Documents section, you'll scroll down until you see the drug costs with extra help. Our 2022 low-income subsidy grids will be available in early fall. For this demonstration, I'll show you how to use our 2021 drug cost with extra help grids. You'll open them up, and the first thing that you'll notice is on the left-hand side the low-income subsidy numbers 1, 2, 3, and 4. This is the level of low-income subsidy that someone has that impacts what their cost share amounts are when they go to pick up a prescription. Below is a low-income subsidy amount of 100%, 75%, 50%, and 25%. This number represents how much of their premium will be picked up for them based on that low-income subsidy level. Most times, you'll notice that individuals with a low-income subsidy level 4 will fall under the 75, 50, or 25% low-income subsidy. The other levels, 1, 2, and 3, typically fall under the 100%. Then you will notice, as we move through the charts, if someone is a low-income subsidy level 1, and their prescription is between a tier 1 or tier 2. As you move across the chart, you'll see what their cost share amounts will be in each stage of prescription drug coverage. Stage 1 being deductible, Stage 2 initial coverage limit, Stage 3 the coverage gap or donut hole, and Stage 4 catastrophic coverage. If someone who is low-income subsidy level 1 takes a prescription that falls under tiers 3 through 5, depending if that prescription is a generic or brand, then determines what their cost share amounts will be in stage 1, 2, and 3, and then again as we move on to catastrophic coverage, their cost sharing amounts would be 0. As an example here, if someone takes lisinopril, that's going to fall under that tier 1, so we know in the deductible stage, initial coverage stage, they're going to pay $0. In stage 3, since that's a generic, they'll pay $3.70, and then in stage 4, catastrophic, they'll pay 0. Again, it'll be dependent on what level of low-income subsidy they have to then determine what their cost share amounts will be on the prescriptions, and it's also dependent on the tier of the prescription as well as if it's a generic or brand. And that is how you use the low-income subsidy charts.